If you have diabetes, this means that your blood contains too much glucose, which is blood sugar, and as a result of this, it will also have too much insulin. High levels of sugar and insulin floating in your blood can cause major damage to your heart and arteries. It can damage your brain and nervous system, the kidneys, and your eyes in particular. Diabetes can also cause changes in your skin and stop your body from healing properly. In this video, we will be exploring the top 6 vitamins and supplements that you can use to prevent your diabetes from damaging your organs and also to help reverse these complications. Just a quick reminder, this is for educational purposes only, so do speak to your doctor if you have any medical concerns. The first and most powerful vitamin on this list is called benfotiamine. One of the main complications of having diabetes is nerve damage, especially in your feet, your hands, your kidneys, your arteries, eyes, and your brain. High blood glucose from diabetes will cause damage to your blood vessels, and it can also destroy the coating that surrounds your nerves. This causes tingling, burning, stabbing, shooting pains, and numbness in your limbs, especially in your feet, your toes, or your hands. To prevent this, you can take 300 milligrams of benfotiamine twice per day as a diabetic to prevent further nerve damage and also to reverse any existing damage to your nerves. Benfotiamine is a fat-soluble version of vitamin B1, meaning that it can penetrate deep into your nervous system and your brain to help regenerate your nerves from within. Benfotiamine is often used as a medication in Europe for diabetics, as it also helps to lower the risk of developing heart disease, kidney problems, and retinopathy in the eyes. Insulin resistance has also been linked to Alzheimer's disease and dementia, so taking B1 in any form may also help to lower the risk of these complications in your brain. Vitamin number 2 is called coenzyme Q10. Coenzyme Q10 is this antioxidant molecule that's found in every single cell within the human body, and it helps to protect your cells against free radical damage to the DNA. Unfortunately, common medications that are used for diabetes, like metformin and sulfonylureas, can often cause you to have a coenzyme Q10 deficiency. This can lead to some major muscle pain, cramps, heart disease, and a higher risk of heart failure and death. So please do take note of this one. So to overcome this issue, you can simply start taking a daily supplement of coenzyme Q10 at a dosage of 200 milligrams per day, using the form called Ubiquinol. This supplement can help to keep the blood pressure under control with diabetes. It can improve blood sugar control. It can protect your heart and kidneys, and it also prevents the skin from aging too rapidly. Alternatively, you can get your CoQ10 by eating it naturally from organ meats, fatty fish, cauliflower, and broccoli. If you're finding this information helpful at all, please hit the like button, subscribe, and turn all notifications on to stay updated with my latest health and nutrition tips. Now, number 3 is absolutely vital, and it involves antioxidants. When you have diabetes, the higher level of sugar can start to bind with the hemoglobin in your blood. This is called glycation. Glycation is where sticky proteins form that can clog up the tissues and the blood vessels of your eyes, your kidneys, your arteries, heart and brain, and other tissues in the body. In order to reduce this glycation and reduce the production of advanced glycation end products, you will need to focus on getting lots of antioxidants in your diet. Again, this is absolutely vital if you're a diabetic. First of all, vitamin C is essential and can only be obtained by eating raw fruits and vegetables that have not been heated or cooked. The best sources are peppers, cabbage, sauerkraut, berries, lemons, and leafy green vegetables. Vitamin C can help to protect your vital organs, like your heart, against glycation and oxidative damage. If you decide that you want to take a supplement with vitamin C, make sure that you choose a whole food powder blend made from acerola cherry, rose hips, or camu camu. As the over-the-counter supplements called ascorbic acid do not have the same effect as natural products. Vitamin E is also a potent antioxidant that will prevent glycation in your blood and can be found in foods like sunflower seeds, almonds, avocados, and extra virgin olive oil. If you want to supplement, the best form of vitamin E is called tocotrienols at a dosage of 300 milligrams per day. I also recommend that you expose your skin to the sunlight for 20 to 30 minutes daily to raise your vitamin D levels, as this is a potent inhibitor of the sticky proteins in the blood and can massively reduce diabetic pain in the feet, the hands, the joints, and especially the lower back. Alternatively, you can take 10,000 international units of vitamin D3 with 100 micrograms of vitamin K2 on a daily basis. If you don't have much access to the sunshine because of the weather or the climate in your country. Now, when it comes to protecting your eyes against diabetic damage, there is no more powerful nutrient than zinc. This is a trace mineral that can prevent blurry vision, cataracts, and damage to the retina at the back of your eye. Zinc can also help cuts, wounds, and scrapes to heal faster, reducing the risk of tissue death, especially in the feet. You can get this antioxidant called zinc by simply eating shellfish, oysters, pumpkin seeds, and lots of grass-fed red meat. Now, let's move on to vitamin number 4, which is B vitamins. Earlier in this video, we discussed how vitamin B1 is essential to protect your nerves from damage when you have diabetes. The same can be said of the entire B vitamin complex, particularly vitamin B6 and B12, which can help to build and restore the protective coating around your nerves. You can also get supplements which contain the methylated forms of B vitamins. However, I recommend the best natural source is nutritional yeast flakes. Again, I recommend eating at least 3 tablespoons of these on a daily basis and mix them with a little kefir to help prevent nerve pain, help control your blood sugars, and maintain normal neurological function in your brain. Please ensure, however, that you use unfortified nutritional yeast that has some added methylcobalamin or natural B12, as this will be a more natural product without the side effects of synthetic vitamins. Number 5 is more of a natural remedy than a vitamin, and it's acetic acid. One of the main reasons that people become diabetic in the first place is that they eat too frequently throughout the day by snacking, drinking sugary liquids, and simply eating too many meals. All of this eating causes large amounts of insulin to build up in your blood, which can trigger insulin resistance in the cells. The cells then stop accepting the sugar, so your blood sugars start to increase uncontrollably, and this is diabetes. One of the best ways to help reverse this insulin resistance is to perform intermittent fasting, where you eat all of your calories for the day in a strict 6-hour window, allowing your body a further 18 hours to rest and digest. This is the most important technique as it helps to open up your cells and improve the sensitivity of the hormone insulin in order to drop and control your blood sugars. The problem with fasting at the start is that you may get very hungry, so what can you do about this? Well, I recommend that you start drinking 1 to 2 tablespoons of raw, unfiltered apple cider vinegar in a glass of water with each meal of the day inside your eating window. This will help your body to produce butyrate, which can have an anti-inflammatory effect in the body, helping to improve insulin sensitivity and keep you feeling full, energized, and satisfied with fewer cravings for sugar. By helping to control your blood sugars, the acetic acid in the vinegar can also help to prevent diabetic nerve damage in the eyes, the kidneys, and the digestive system. One thing to mention, however, is that if you've been diagnosed with gastroparesis, where your stomach isn't emptying fast enough, you may want to avoid this and use another supplement called alpha-lipoic acid, as this helps to repair the nerves connected to your stomach at a dosage of 600 to 1800 milligrams per day. But do speak to your doctor before using any of these remedies. Let's talk about phytonutrients for number 6. To protect yourself from glycation, oxidative stress, and inflammation caused by diabetes, you don't necessarily have to take any supplements at all. Modern scientific research shows us that there are many different natural chemicals found in foods and plants that can help protect your body against the complications of diabetes. So let's take a look at these. We have turmeric, a golden-colored spice that can be used in curries to support the cells that make insulin in your pancreas. Blueberries contain resveratrol, which can inhibit glycation in your body. Red onions contain quercetin, which helps to control your blood sugars, protecting your heart, kidneys, and nerves. Green tea contains a phytonutrient called EGCG, which helps the beta cells in your pancreas to produce more sensitive insulin. Bitter melon is a fruit that's used fresh and in supplements, as it's rich in phytonutrients that can prevent glycation in diabetics. Eating raw garlic can supply allicin, a sulfur compound that prevents glycation and also keeps your immune system strong against infections. Red cabbage is also rich in a pigment called cyanidins, which again prevents sticky proteins from forming in your blood. And finally, you can start adding some freshly chopped parsley to your daily salad, as this contains powerful antioxidants called apigenin. I recommend that your first point of call for protecting yourself from diabetes is simply making a large leafy green salad every day that contains lots of different colors of vegetables. This will provide the antioxidants and the phytonutrients you need to help lower the risk of diabetic complications.